President-elect Joe Biden announcing a $1.9 trillion COVID relief package, and it includes $416 billion to help launch a national vaccination program. So his big goal is actually immunizing 50 million Americans within his first 100 days. Here's Biden's earlier.
We're going to make sure state and local officials know how much supply they'll be getting and when they can expect to get it so they can plan. Right now, we're hearing that they can't plan because they don't know how much supply of vaccines they can expect and what time frame. That stops when we're in office.
Well, given the sort of sluggish rollout we've seen so far, Biden's goals certainly seem ambitious, but are they realistic? NBC News Now correspondent Mara Barrett takes a close look at his upcoming plans.
Every day, thousands of Americans are being vaccinated to combat COVID-19, but the timeline is moving more slowly than initially promised. President-elect Joe Biden says distribution is at the top of his to-do list once he's inaugurated.
We will mobilize thousands of clinical and non-clinical professionals. Think of the people that we deploy in natural disasters. Additionally, we're going to expand the pool of medical professionals, including retired healthcare workers, who can administer the vaccine and to ensure we have enough vaccinators to meet the nation's needs.
Health experts say lack of federal guidance is a major reason why we're seeing such stark differences in how states are progressing. This week, Senate Democrats sent a letter to the Trump administration demanding it makes changes to the rollout strategy. Lawmakers writing in part, a vaccine allocated on a spreadsheet or even a vaccine distributed and sitting on a shelf is not enough to protect anyone. The metric that matters and where we are clearly moving too slowly is vaccines in arms. Shortly after, Operation Warp Speed issued a new recommendation that states should expand access for those aged 65 and up. So how could Biden's leadership speed up the vaccine rollout?
We have some challenges in knowing what vaccine is coming a week or 2 weeks from now. And we also have hospitals and public health departments that have been stressed for more than 9 months in responding to a pandemic. So there are lots of potential root causes for what's driving the slowness of the distribution. And so therefore, there may also be lots of different solutions that are needed.
Biden's website indicates he'll invest $25 billion in a vaccine manufacturing and distribution plan.
I'm convinced the American people are ready to spare no effort and no expense to get this done.
Operation Warp Speed had originally argued that it was, quote, necessary to withhold some available doses of the vaccines to ensure everyone would be able to receive their second dose on schedule. Biden plans to break away from this, with intentions to release nearly all available doses to speed up distribution.
We do have a reliable, consistent supply that will be used to make sure that everyone gets their second dose on time.
Since Biden's announcement on this, the Trump administration also reversed course on their plan.
The president-elect has said he will use the Defense Production Act as needed to help produce materials and whatever else is needed to ensure supply.
Biden originally vowed to get 100 million vaccinations administered within his first 100 days in office. His campaign now hedging expectations.
Well, the president-elect, Allison, is very committed to trying to make that work. That said, we really do have our work cut out for us. I think there is still a glimmer of hope that we may still be able to accomplish this, but it's really going to require everybody working together, not squabbling over partisan issues to get the job done.
While individual state-by-state plans are facing criticisms and centralized vaccination efforts tend to be faster, Dr. Swan says they could face other challenges.
There is one instance of a state using National Guard to help with vaccine distribution. I think generally there is some reluctance in some states to use this, and that could have the potential of politicizing the vaccine further in some of those states.
On my first day in office, I'll instruct the Federal Emergency Management Agency, FEMA, to begin setting up the first of these centers. By the end of our first month in office, we will have 100 federally supported centers across the nation that will ultimately vaccinate millions of people.
We know that a plan that's based in decision-making authority at the state and local health departments can work. There are different kinds of populations, including communities of color, that differ with different vaccine hesitancies and different kinds of locations where they seek health care. So really, any plan must take into account the preferences and structure and community associated with state and local health departments.
With several routes available for Biden's improvement, the pressure is on as the second strain of COVID-19 sneakily spreads across the country, more contagious than the first.
This will be one of the most challenging operational efforts ever undertaken by our country. But you have my word that we will manage the hell out of this operation.
Hospitals that are overwhelmed treating COVID patients are now looking to transfer patients who are still sick to long-term care facilities or even to nursing homes to help free up some space. Some critics say this is making an already bad situation even worse. MSNBC senior national correspondent Chris Jansing joins us now live. Chris, places like Michigan have actually mostly banned the transfer of many COVID patients to nursing homes. So why then are these officials pushing for this strategy?
Well, as you know, there is a terrible situation in California. The hospitalization numbers there exceeding the national average. And beyond that, one hospital official I asked said his situation at his hospital isn't out of the ordinary. When I said, how much more are your ICUs filled than they used to be? He said 100%. They're taking entire wings of hospitals and converting them essentially into ICUs. And also, every state has different rules about when you can do this, how you can do this, what the strategies are for doing this. But in California, it actually changes from county to county. I spoke to the CEO of the California Hospital Association, who told me there's no time to waste. The situation is dire and not sustainable. Take a listen.
All of the projections show us hitting another peak beginning this weekend and over the next 7 to 10 days. This is the beginning of the peak of the interactions that took place over the Christmas and New Year's holiday, resulting now in hospitalizations some 2 weeks later. Those numbers are extraordinary. And those are numbers of patients needing hospital care like we have never seen before. So this really is the last handful of days we have to organize and prepare and do everything we can to free up as much space within California's hospitals to care for as many people as we can.
At least in terms of the trajectory, Morgan, you know this well. Every expert pretty much, and even Joe Biden said today, the situation is going to get worse before it gets better.
Which is interesting, Chris, because you also learned that there is a financial incentive for other facilities to take in patients. Can you explain a little bit more about that?
Yeah, let me explain a little bit about the other side of this argument, which is that nursing homes, even before the pandemic, were already stretched thin in many places, that they were at their very limit. And now, in many cases, COVID patients are being brought in. Their actual staff in terms of doctors and nurses is very, very small. Mostly it's certified nursing assistants who work there. Questions being raised about these kinds of patients who may be transferred because they're doing better, but then can very quickly turn ill again, being brought into already a situation where the numbers are as bad as they get. What one patient advocate told me is, look, they sometimes get more money to take a COVID patient than they do for a normal nursing home resident. And so that is an incentive for them to take these kinds of patients, even if they don't have the staff to handle this. This is an ongoing debate. And what we're seeing is a lot of confusion and chaos, much like we saw at the beginning with masks and we continue to see with the vaccine rollout, Morgan.
Yeah, really difficult dance. All right, Chris Jansing, thanks so much for joining us. Really appreciate it.
Thanks.
The global death toll from the coronavirus just hit a staggering number, 2 million lives lost to COVID-19 in just over a year. And that's according to data from Johns Hopkins University. Here in the United States, that death toll now topping 390,000. Public health physician Dr. Chris Purnell joins me now with more. Dr. Purnell, behind those statistics are very real people. And you, I understand, were inspired to take part in the Moderna vaccine trial after losing your father and your cousin to COVID-19. And I'm sorry for your loss. And I really want people to understand just what that means. Behind these numbers are people we know, people we love. Can you tell us a little bit more about your experience?
Sure. I think it's utmost importance to talk about the faces of the pandemic, Morgan, as you were describing. I lost my 78-year-old father on April 13th due to the COVID pandemic. And I also lost my cousin recently, who was an essential worker in Newark, New Jersey, a postal worker. And he had a catastrophic stroke because of COVID-19 complications, as well as my sister being what we call a long hauler. So it's important that when we say that this pandemic has devastated Black and brown communities, that people really have a sense of just how staggering that toll has been. And I can tell you that personal experience, in addition to what I've seen in my role as a public health physician, really was fuel, fire in my belly to get involved, to really help us arrive at a solution. So that's why I volunteered for the COVID-19 vaccine trials.
And you're brave for doing so. I mean, I think you talk about Black and brown communities. Speaking personally, I've had lots of conversations with people who are kind of taking a wait and see approach, Blacks and Latinos saying, look, I'm not sure. Given the history in this country, I need some time to see how this vaccination plays out, with people who've had it for a while. What do you say to people who are reticent to get the vaccine?
I hear that every day, and I spend countless hours, but they are worthwhile hours having conversations with people to help allay those fears and concerns. First and foremost, we have to validate those concerns. We have to meet those concerns with empathy and with science. And then I like to give my personal experience. I found out, I was unblinded, that I actually did receive the vaccine as part of the trial. So I've had my 2 injections of Moderna since October 2nd. And I use my example. That I haven't had any lingering side effects since those 2 injections, that when I did encounter side effects, they were tolerable and they were short-lived. And I tell people the wait and see approach can truly turn out to be deadly. The mortality rate in Black and Indigenous communities exceeds 1 in 750. The mortality rate in Latino communities is approximately 1 in 1,000. And even for those who don't die from coronavirus, the morbidity, out of a study coming out of China, it showed that those who had been hospitalized because of coronavirus, about 75% had one lingering side effect or one lingering adverse outcome because of the infection. And I can tell you, my sister has had that experience. So it's not worth those cumulative risks. It's not worth it. And I say it's better to have a listen to the science, have a listen to the data, and to consider what's truly at risk.
I really hope people heard what you said, that wait and see approach can be deadly. And speaking of that Moderna trial, Moderna is planning to give people who participated in that trial a booster shot to test the need for follow-up shots. So can you explain medically why that booster might be necessary?
So this is exactly what we want the science to be doing, evolving. So what we know to date, we know that 2 injections of both Moderna and Pfizer have studied, that those injections need to be followed to see how long that immunity lasts. We know that the immunity probably lasts for about 90 days, and that's really about natural immunity. What this study will help us to understand is what is the immunity afforded by vaccination, being able to give people an additional dose 1 year later, because that's what Moderna is going to do. We'll be able to say, hey, this is a type of vaccine that we'll have to receive on an annual basis, or this is a vaccine that's going to have long-standing immunity. And we need to have that level of a definite and clear answer so that we actually lock down the pandemic. I use that expression expressly because we don't want to be in a situation where the pandemic comes back because we haven't appropriately protected people for the amount of time.
And doctor, let's talk briefly about the treatments. NBC News is reporting that monoclonal antibody treatments for COVID are going largely unused, and that's mainly because of lack of time, resources, awareness. So what do viewers need to know about this treatment? And frankly, what do our viewers need to know about how they can get it?
I was just doing a town hall where I referenced this the other day in Newark, New Jersey. I had a person in community reach out to me who had been seen in an urgent care facility, a Black woman, approximately in her late 50s. And the doctor there told her, okay, you're not severe enough to be hospitalized. Go home, isolate for the 14 days and follow up if your symptoms worsen or get more severe. But I knew that she would be a candidate for the monoclonal antibody therapy. So what people need to know that if you are above a certain age, if you're 55 or older, if you have certain risk factors, if you have high blood pressure, if you have COPD, if you have diabetes, if you have what we classify as morbid obesity, if your BMI is equivalent to or above 35, you need to be evaluated for monoclonal antibody therapy to see if it's appropriate for you. Because when it is used, it typically shortens the duration of the symptoms that you experience, and it shortens the severity of those symptoms.
And doctor, just before I let you go, the CDC is warning the highly contagious UK strain of COVID that we've all been talking about could become the dominant strain here by March. So aside from social distancing and, of course, mask wearing, are there any other safety tips you have for our viewers?
Get vaccinated. I can't put it more or clearly than that. Those public health measures that you described are our baseline, our foundational measures, right? Even if you are vaccinated, continue to wear your mask, continue to do frequent hand hygiene, and continue to physical distance. Please avoid large events, especially indoor crowded events. Avoid those things that increase your risk. Other than that, we on the public health side, we need to continue to do surveillance. So testing of the genomes of these different variants that come up to ensure that we understand what's happening.
Dr. Purnell, thanks so much for your courage. Thank you so much for your clarity and your messaging. We really appreciate your time.
Thank you, Morgan.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.